Okay, so you guys know this. Now we just continue with this story. Now more parts of the heart. I'll introduce you with the models over here. The lining of the cavities have special names. They look like a very treacherous area. Kind of looks like Freddy Krueger's burn marks on his face. Okay? It's just the way the development of the heart was that created these burn marks. They're not burn marks, but they look like that. In the atria, it's called musculi pectinati. In the ventricles, it's called trabecular carni, and it has this burnt-like look that Freddy Krueger's got. You'll see it in the models. You'll see it in the dissected hearts. You'll be able to see this, okay? And it has that burnt kind of look on here, all right? Now, the great vessels, all right? Just review for you guys. The vessels returning blood to the heart, they're veins, okay? We have the superior and inferior vena cavae, okay? And the right and left pulmonary veins. So what's going to happen here is that if this is your heart, okay, you have a lung over here and a lung over here. There's going to be two pulmonary veins coming from one lung and two pulmonary veins coming from another lung. Therefore, in the left atrium, there's going to be 4 holes in there. 2 from the right and 2 from the left. Okay? And you'll see them on the pictures here. The pulmonary trunk is going to split, as you've seen, into pulmonary arteries, right and left. The other thing I want you to know, it's really the start of blood vessels, but might as well just show you now. But if this is going to be your heart, we have the aorta that comes out from the left ventricle. It does this arch, the aorta. This is what we call the ascending aorta, the aortic arch, and the descending aorta. You get to know that a little bit better. There's 3 blood vessels that come off the aortic arch. We have one like that, and like that. The first branch, and I'm just going to abbreviate to speed up time, the first branch is called the brachiocephalic artery. The second branch is going to be the left common carotid artery. And the third branch is going to be the left subclavian artery. The left subclavian artery gives blood supply to the left shoulder and arm. The left common carotid artery gives blood supply to the left head and brain. We do have a right common carotid. We do have a right subclavian. But this is how God created us. The brachiocephalic breaks off into 2 things. Now this is going to be the right subclavian artery. This is going to be the right common carotid artery. It's on that list when I go up there, why he or she created us like this. okay? I don't know why, just accept it now and move on, okay? We think we would be a little bit more symmetrical, but we aren't. This helps you when you're going to be assisting a doctor or become a doctor and putting a catheter in someone, and you need to know the blood supply because you need to know how things are split up with blood vessels. Okay? So here is, and you'll see on here, like on these models here, there's your aortic arch. There's 3 branches that come off of it. That's the brachiocephalic artery. There's the left common carotid artery, and that's the left subclavian artery. Okay? And many of the other models show the similar things. So, what we got over here, you're looking at the anterior view of the heart. This is the auricle, the right auricle. Now, the right atrium is a space. It's a cavity. You can't hold on to it. Like this room is space. But you have a roof over it that you could actually touch, right? Well, the right atrium has a roof over it too. It's called an auricle. Okay, auricle means ear, and it looks like an ear. That's what this is right here. All right? On the exams, if you put this as the right atrium or right auricle, I'll give you full credit. I'm not going to be a stickler about that. Okay? But just when you see it in your studies, in the textbooks and lab books, that's what they're talking about. This is the auricle. So you have a right auricle, you have a left auricle. Here is the right ventricle. Here is the left ventricle. The left ventricle is a bit bigger than the right. It's just you can't see it from the anterior view. It's bigger when you view it from the lateral aspect. This is going to be your pulmonary trunk, leaving the right ventricle. The pulmonary trunk splits into 2 pulmonary arteries, going to the lungs, carrying deoxygenated blood. You also have the pulmonary veins. There's 2 from over here, and there's 2 over here. Now you can't see it, but it does enter the posterior aspect of the heart. But these 2 are actually going into the left atrium. You'll see it on other pictures here. Okay? And there's your 3 branches off the aorta. Okay? You'll also see the superior vena cava here and the inferior vena cava here. The inferior vena cava is going into the right atrium. You just can't see it from the anterior view. Okay? Now, blood vessels that supply the heart itself. Even though the heart has blood in it, the muscle of the heart is tissue that needs oxygen and nutrients like every other tissue in your body. So we're going to have arteries coming off the aorta to give blood supply to the muscle of the heart. Does that make sense? Okay? So that's what we have. We call them the coronary arteries. So we have the right and left coronary arteries. You don't have to worry about, at least for this class, okay? Probably grandfather clause them, because I'm probably going to have to tell you the next classes to know it, because other teachers want them to know it. And you should, because heart attacks are the #1 killer in America, so you should know branches off of it. But for right now, just know the right coronary artery and left coronary artery. And then there's branches that would, and it shows you what they go to. These are the first 2 branches off the ascending aorta. So we have a branch coming off of here and another branch coming off of here. So these are the first branches of the aorta. Be careful with that on exams, lecture exams and stuff. What are the first branches? What's the first branch or branches coming off the aorta? People will go right to this one and say brachiocephalic. That's wrong, because that's coming off the aortic arch. These are the first two coming off of the aorta. Don't be fooled by that, okay? The way they come off the coronary arteries is, if you look at a bird's eye view of this, they're going to, if this is the aortic valve or the aorta, and here's the pulmonary trunk with the pulmonary valve, they kind of hug around here, like people love, right, with the heart. You'll see it better when there's one in front of you. I mean, they all show it, but I'm trying to, this one is more pronounced. This is the pulmonary trunk, this blue thing, okay? It's blue because it's deoxygenating blood, okay? But it's an artery, it breaks off into arteries. You'll see here the aorta, or the aortic, ascending aorta. There's a branch of the coronary, this is the right coronary artery on this side, and on the other side of the pulmonary trunk, you'll see the other coronary artery. They hug the pulmonary trunk, okay? All right. It's not that two are coming out on one side. One comes on one side and one comes on the other. That's what I'm trying to emphasize there, okay? Veins. Again, dumping the blood. Now, how many blood vessels go into the right atrium? 2, right? Which ones? Superior and inferior vena cava. But I lied to you. There is another one, a smaller one. It's called the coronary sinus. So there's 3 that go in there. The coronary sinus is going to drain or bring back deoxygenated blood from the muscle of the heart. So the coronary arteries give blood supply to the muscle of the heart. The coronary sinus is going to bring back deoxygenated blood from the muscle of the heart. It doesn't matter. What I'm saying is, you have superior vena cava carrying deoxygenated blood, you have superior vena cava carrying deoxygenated blood, and now you have the coronary sinus that's carrying deoxygenated blood. All of that is going to obviously dump in the right atrium, which is going to push it into the lungs and go into there, okay? And these are the other things that go into the coronary sinus. You just have to be able to recognize the coronary sinus. This is the anterior view of the heart. Here's the posterior view, which I'll show you on another picture. But the coronary sinus goes right across there and empties in the right atrium. Okay? So again, you don't have to worry about the branches of the coronary arteries and the coronary sinus, but in a future class, you may, well, I'm sure you're going to have to do that. So these are pictures that students have come back to me and said, can you give us good pictures, because we're confused about the trajectory of this. So you can see it over here. Here's the arterial and venous parts of those. And to me, I know it sounds weird, but to me, it kind of looks like a modified jockstrap. All right? Knowing that it looks like a modified jockstrap, it's going to help you to determine, oh, okay, so I understand you got the circumflex that's going to go around. That'll be around the waist. You see what I mean? Like, it'll help you to study this, okay? This is what it looks like in real life, and here's the coronaries, the venous, okay? And that's what that is. So again, here's the anterior view, but here's the first time you're looking at the posterior view of the heart, okay? So here's the right atrium, here's the left atrium. Now we turn it around, This is going to be the left atrium, that'll be the right atrium. Here's the superior vena cava, inferior vena cava going into the right atrium. You also see the coronary sinus going this way and also entering the right atrium over there. You'll also see that on the back of the left atrium, you have 4 openings. These are your pulmonary veins. 2 came from the left lung and 2 came from your right lung. So there's the front view. You can see that here's a coronary artery and there's the other coronary artery. They're going to go on either side of the pulmonary trunk. All right? They're going like this, not like this. Right? They're hugging it. Turn it around. So here's where it is. Now we're going to turn it around. Now this again is the left side and this is the right side. Right? Look at the posterior aspect. So this is your right atrium. There's the superior vena cava, inferior vena cava that came from below. There's the coronary sinus going across, and it's going to enter here into the right atrium. Your left atrium is here, and there's your pulmonary veins. 2 from the left side, 2 from the right side. And you'll see them. Here's the posterior aspect. 2 from one side and 2 from the other side. Okay? And just for your, to be complete and FYI, if you're curious about what are the more common branches of the coronary arteries that get clogged and you have to do bypass surgery because of myocardial infarctions, I put that there showing that. There's that one and these 2 over here. Again, I won't ask you about those, but I know that I know that everyone in this classroom knows someone who has had a heart attack. All right, because it's the #1 killer in America. It's that common.
What's the difference with what they refer to as the widowmaker?
What's a widowmaker?
It's some type of heart attack. It's very hard to detect, I guess, where it's happening.
I never
So
heard of it.
I don't know.
I'm sure there is. I just never heard of a
Sorry,
widowmaker.
I didn't know if you knew what that
No.
exactly was.
I know if it has something to do with this. I know that women who have heart attacks don't have many symptoms. So it's like this silent one, and I don't know if that's a widow.
Maybe that's what it is. But
Yeah, I don't know if that's.
Yeah.
Yeah,
Okay.
I don't want to mislead you. I just never heard of it like that. Okay. What's that? Yeah, well, that works the other way too. Either way, it'll give you a heart attack. Okay. What's that? Yeah, I don't even know why they refer to it as the widowmaker. I mean, LAD is the #1. 40 to 50% is due to that. I've never heard of it. It's layman terminology. I mean, medical terms, I know it is the left coronary artery that gets mostly blocked. Okay. All right. So the atria, right? A little bit of review. We have that protruding auricle, that roof that goes over the atria. It's where the left and right ones. You know, those Freddy Krueger looks, the pectoral muscles kind of thing. The right atrium, we have 3 openings there now, superior and inferior vena cava, and the coronary sinus. The left atrium, there's 4 openings there. 2 pulmonary veins from one lung and 2 pulmonary veins from the left lung. Now, do this heart again for you. All right. Again, right atrium, left atrium, right ventricle, left ventricle. There's a wall that separates the right and left atria. It's called an interatrial septum. Okay? The wall that's between the two atria. Now, I'm going to just briefly explain this to you, but we'll go more into it when we get into the fetal circulation. But I want you to understand where these anatomical structures are and a little bit of where they came from. Normally, where does blood come from? Don't worry about, let me take that off because I don't want you to be concerned with that yet. Normally, where's the blood coming from when it goes into the left atrium? What organ? The lungs. Is it oxygenated blood entering the left atrium or deoxygenated? Oxygenated. Normally, what type of blood enters the right atrium? Deoxygenated. Okay? And that's what it is in, I don't even want to say in the adult heart, we'll say about a postnatal heart. After you're born, that's how it is. But it's a little bit of a different story when we deal with the fetus. What happens here is that this atrium, this interatrial septum is more like this. There's an opening there, a hole. Now what happens here, and just accept it now, I promise you, I'll explain it when we get to fetal circulation, but you're not there yet until we get to circulation. But in the fetus, there's going to be oxygenated blood entering here. And a lot of it, it's coming from the placenta. Okay? The lungs are still developing the fetus, so there isn't going to be much blood going to the lungs. So the lungs aren't functioning in a fetus. They're not going to, do gas exchange. So there's going to be very little blood entering the left atrium from the lungs. It's a different story in the adult, or the child for that matter. The pressure is very high over here, but low over here. But in a fetus, the pressure and oxygenated blood is very high here in the right atrium. But we don't need it to go to the right ventricle, to the lungs. Like I said, there has no relevance for oxygenated blood going to the lungs. So there is going to be this valve, this opening here. And when the oxygenated blood enters the right atrium, it's going to squeeze on through and go into the left atrium. Now this oxygenated blood goes into the left atrium, to the left ventricle, into the aorta, into all the parts of the body that it normally would need to go and give the body oxygenation. Okay? That's what happens in the fetus. Then what happens is, when the baby comes out, we cut the umbilical cord that's attached to the mother. Now the blood pressure here is going to be very low, because we just cut off the blood supply going there, basically. Not cut it off, but diminished it royally. So now, there's going to be very low pressure here. But now, what does the baby do when the baby gets out? What's the first thing it wants to do? Right? It's going to scream, and it's going to shunt blood going right into the lungs to get oxygenated. Now the lungs are loaded with blood. And that blood is going to return to the left atrium, and the pressure here is going to be big. It's a reverse of pressure now. When the pressure is here higher, it's going to this valve here, and this opening is called a foramen ovale. It's all written up there, you'll see it. Foramen, as you learn from bones, is a hole. Ovale because it's round, or oval rather. Okay? So this foramen ovale, when this pressure is in the left atrium higher than it is in the right atrium, then this valve is going to close. Now there's a little impression there. depression rather. That's called the fossa, as you've seen before, fossa or fossa ovalis, because it's still oval, but it's not a hole anymore, it's a depression. And you'll be able to see this in the heart. Hopefully I got it. Alright, where my pointer is. That little depression. The pointer is in the right atrium, and you can see that depression there. That's the fossa ovalis. Okay, right there. Okay. Well, I'll get into that. Okay? So you see where that fossa ovalis is. Okay? Now that's a landmark for doctors, which I'll probably explain later for you. Now, if this doesn't close properly, then blood could go into either area. So you're going to have a mixture of blood, oxygenated, deoxygenated, not good. We call this opening an atrial septal defect, an ASD, or laymen call it a hole in the heart. Most people, when they talk, and laymen, when they talk about hole in the heart, they're saying, well, I had a hole in the heart when I was born, and they're thinking this, a hole in the heart like that. That wouldn't make any sense. And probably half the class has already thought about that, but you can't. How could, now blood is going to go out into your cavity? You'd be dead, right? So you got to think about this. But the layman would say, I had a hole in my heart when I was a child. Well, yeah, and you did. But the question is, was it here or here? Oh no, it was right in there, right in the wall. Do you understand? You gotta, don't laugh at them, but that's their mentality. You guys are going into the medical field, and you know that's incompatible with life, right? I mean, if that happens, it would be called something like cardiac tamponade, but you couldn't live with that for very long. It would probably be a few minutes, maybe an hour or so. It just would fill up. You can't do that, okay? They have to resolve that. So that's what an ASD is, or a hole in the heart. Now the ventricles. The atria are the receiving chambers. They receive the blood. The ventricles are the discharging chambers. They're going to discharge the blood out of the heart. The right ventricle is going to pump it through the pulmonary trunk to the lungs. The left ventricle is going to pump it to the aorta, to the rest of the body. And like I said before, the thickness of the left ventricle is much thicker than the right ventricle, because the right ventricle only has to pump it to the lungs, which is right nearby. The left ventricle has to pump it throughout the whole body, so it's got to give a nice strong push. So it makes sense that the left ventricle wall is thicker than the right. Okay? We also have an interventricular septum that separates the two ventricles. And you should also note how that develops. This is much simpler than the other one. In this case, in the fetus, it kind of moves up here and moves down here until it closes. much easier to express. But again, if this doesn't fuse properly, you're going to have a hole there. That's called a VSD, a ventricular septal defect, which is more common than an atrial septal defect.
Are there factors that contribute to like an ASD
Mm-hmm.
other than?
There's teratogens. In other words, things that the woman might be taking, certain medications, there's some genetic factors that happen too. Down syndrome is pretty common that they would have something like this. So there's a lot of factors that environmental or genetic.
Okay.
Okay, that's why you got to talk to the doctor and see, taking this medication, what are the chances of having a VSD, ASD? They'll talk to you about that. But yes, there's environmental and genetic factors.
You can see all this in utero too, before the baby's born, right, or now?
Yes. Uh-huh. But we wouldn't think about doing this until they get their first ultrasound at about 18 to 20 weeks. They don't just do ultrasounds early. They do, because you can't really see things until about 18 or 20 weeks. If there's two babies there, if there's two arms. You can see stuff earlier, but it's not cost effective to do anything earlier until things are actually formed. Okay. Other questions? Now, let's look inside the heart. This is the right atrium. There's a superior vena cava, inferior vena cava, entering the right atrium. Here is the left atrium. You can see two pulmonary veins coming in here and two on the other side, but you gotta look on the other side. But there's 4 holes in the left atrium. You'll also see the tricuspid valve. And we'll talk about that in a second. The tricuspid valve, and you got the bicuspid valve, or mitral valve. Those two look very similar. It's got these strings going down. But you also have the pulmonary valve, and it's usually hidden, but the aortic valve is over here, and they look similar. Okay? We also have these spikes going up. We'll talk about those. You could also appreciate a little bit about the Freddy Krueger look. All right? In the ventricles, you can see it too. Trabecular carni. You'll also see the interatrial septum that separates the right atrium from the left atrium. You'll also see the interventricular septum that separates the right ventricle from the left ventricle. Notice the thickness of the wall in the left ventricle is much thicker than the wall in the right ventricle. A lot of things to see there. With the models and the dissected hearts, you'll see that stuff too there. This is really showing you, I took this picture and I colored where the left ventricle is in red. Not very big that you could see on the anterior view, but when you look at the left lateral view, you'll see it takes up more of the space there. It's just the way it's positioned. So the pathway of blood, you know that. You took the quiz already. Okay? This came from your book and showing the same thing going this way. This too came from, I think, your lab book or one of the other books, and I found an error. So don't believe everything you say. Look at it, and you could, to question the teacher, say, is this correct or not? Okay? But number 6 says, blood returns from lungs via the pulmonary arteries to the left atrium. It's not the pulmonary arteries. What is it? You guys know better, right? Okay. So I put that there. All right? All right, valves. Let's talk about those. So we have the atrial ventricular valves, the tricuspid and bicuspid valves, also known as the mitral valve, right? These have those strings down there. Those strings are called chorda tendineae. Some people call them tendinous cords. Same thing, okay? the way it's set up, if I take this valve and I open it up here, like I put a slit over here, so let's say the valve is this way, so you're looking down it. So here's the valve, and blood goes through here. You're looking at the valve. If I cut it here and then roll it out like this, so that it's flat, can you visualize it? It's round like this, blood goes through it. I'm going to cut it here and then make it flat on the table here. What it will look like is this. Okay? These are the cusps, or the leaflets. Then you have strings going down, and they lead to these spikes that are coming down on the bottom of the... The best way I could explain what's going on here is think about flying a kite. You're the papillary muscle, and you're holding the string for the kite. You have the string, which is going to be the chorda tendineae, and the kite itself is the cusp. You need to make sure that when the... What's the smell next? I don't want you to think that I smell. And he doesn't smell either. It's the gel when you're making microscope slides kind of thing, or the dishes, the Petri dishes. That yellow gel is called agar. When they pour it in, it's liquid and has that smell to it. That's what that is. So think of this as flying a kite, and what valves do is ensure one-way blood flow. So if blood goes this way, comes from this area here and goes down, the valve is going to open. When the pressure goes down, it gets stronger down here than it is up here. It's going to build up here and close that valve. So, boom, boom, boom. But we need to make sure that when it closes, it does not do this. Boom, boom. Because now blood is going to go backwards. So this is the mechanism that's controlling that. You're the papillary muscle. You're holding the string to the kite. You feel in the tension when that wind is blowing that kite. You feel the tension through the string, and when you feel it, you pull back on it so that the kite doesn't get flown away with the wind. Does that make sense? And that's what's happening here. It feels the tension of how much pressure is going that way on the valve, and it will stop the valve from closing right there. Does that make sense? Okay, that's the best way I could explain what's going on here.
Was this on every valve?
No, just the atrioventricular valves. Just the tricuspid and mitral or bicuspid valves. The atrioventricular, think of the words. Don't, and the thing is, I find students overall, they think of, oh, I got to memorize atrioventricular. Don't even memorize it. Understand what the word is saying. Atrioventricular, they're valves that connect between the atria and ventricles. Right? I mean, don't go crazy about that. That's pretty easy to memorize. There's a lot of other things that you got to memorize. Don't make the easy stuff difficult. You know what I'm saying? So that's what is going on here. So you can see, this is a pretty neat picture. You can see the papillary muscle, and you can see these chorda tendineae. And you'll see them in the models here, and also in the dissected hearts. Okay? So it kind of does this, right? So blood goes from the atria to the ventricles, and when this starts filling up, it's going to make these leaflets, all right, or cusps, fill up and then make sure it doesn't go backwards, okay? In certain heart attacks, the papillary muscle gets affected and die. And when they die, it's going to cause valvular diseases or conditions. Because now the papillary muscle is not going to feel the tension because it's dead. So now blood can go backwards. So heart attacks can lead to valvular diseases. Does that make sense? That's why when I showed you those, the coronary arteries and the branches and where they go to, that's where it comes in handy. Okay? Now the semilunar valves. Semilunar, it's like half of a moon. That's what they call that, okay? They're going to be your aortic and pulmonary valves. All right, the ones that leave the heart. Now they have a different way of mechanism because there's no chorded tendon going there. There's only strings. Instead, it kind of looks like this, and it's just easier for you to just visualize it. Blood goes this way. Here's the cusp. Blood goes this way, and when there's blood that enters the vessel over here, it kind of fills up these cusps like bowls. And when it does, it kind of closes the valve because they get filled. And now blood can't go anymore out there. Does that make sense? It's a different mechanism. They don't want to have cords going into the blood vessels because that's going to start turbulence. It's going to start maybe possibly blood clots and stuff in that area. Because blood it's a very narrow blood vessel that it's going through as opposed to a big cavity. All right? So my little mnemonic here that is lab rat. The left atrium has the bicuspid valve. The right atrium has the tricuspid valve. That helps you a little bit. Okay? I don't have a mnemonic for the semilunar valves. You probably have it already memorized. You won't even need that mnemonic. All right, so this is just showing you the difference. If you take a cut of the heart over here, then you get to see where these are located in relation to each other. Okay? These are your semilunar valves. Here's your atrioventricular valves. You can see the chorded tendon there. All right? And you could have clinical applications. There could be some valvular diseases that go on. If the valve is supposed to go like this, open and then close, open and then close, open and then close. What if there's a lot of calcifications on here and it's having a hard time opening all the way? It only opens up this way. It's narrow here. Not much blood is going to get in the other one, and there's going to be a lot of pressure on this side. This is what we call stenosis. You could have mitral stenosis, tricuspid stenosis. Stenosis is that it doesn't open all the way. We could hear that blood going through that narrow area, and that's called a murmur. Okay? We could also have insufficiency, or also known as regurgitation. The valve opens all the way, but it goes like this. So that's going to make blood regurgitate back into the cavity it came from. And that's what's happening here. And it goes like that. Okay? And again, you can have mitral regurgitation, you can have bicuspid, or the same thing, but mitral regurgitation, tricuspid regurgitation. Okay? That's what that's dealing with. You have combined effects. You have a mitral regurgitation with a tricuspid stenosis. All right? You can have that kind of stuff. There is something called a mitral valve prolapse. 10% of people have this and don't even realize it. More females than males have it. And what it is, it's nothing really to worry about. In medical school, my roommate had this, and he played baseball for college and stuff, so it's not so worrisome. But what it is that it's kind of a cousin to insufficiency. What's happening here is that the valve opens, and this is how it should be, okay? But in this case, insufficiency is doing this, okay? The mitral valve prolapse does this. It's a little bit of regurg, not so much it's actually going to cause any issues. However, people who have this don't even realize they have it. It's called asymptomatic, meaning like they don't have any symptoms to it. But in a few of these people, as they get older, it can lead to insufficiency, okay, or regurgitation. All right, so they just need to watch it, but you can still play baseball with it as long as you're not getting symptoms, okay? And the treatment for this usually, in these up here, is usually going to be a valve replacement. You really can't fix it. You just have to take it out and put a new one in, whether you use a pig heart or baboon heart, or just a mechanical one that has a plastic in it. I'm sure now with 3D printers, I guess that's what they're leaning towards now, is going to that. So it's a new way to okay? And these are areas, I wouldn't ask you this, but these are areas of the heart that the valves are heard best. So you would hear them in different areas. I don't want you to think that your doctor or nurse practitioner is an idiot, like, they don't know where the heart is. Doctor, it's right here, okay? Like, and he or she's listening to different parts of the heart, okay? All right, you know about the microscopic view. I'm not going to ask you that. I'm just putting it there to be consistent. Again, intercalated disc, you know all about that from A&P1. Not going to bore you with that, okay?